Hello everyone. This week we will explore the social context and physical environment models of substance misuse. You will learn about the interaction between genes and environment. Also, you will identify the components of the social ecological model. We will talk about social norms and stigma. We will talk about social structure models and factors related to treatment and recovery. Also, we will look at the effects of family systems and peers. Let's talk about social contexts and physical environments, and their relationship with substance use. Society tends to stigmatize behaviors that are seen as different and less desirable than what is considered the acceptable norm. Substance use clearly falls into this category. The stigma, prejudice, and discrimination associated with substance use creates barriers to accessing necessary care and support for individuals and their families. Social, public, and health policy are tools that can be used to influence people's substance use patterns. For example, state and federal policies that increase the legal drinking age, specified the age for legally obtaining tobacco products, and established a uniform blood alcohol level for intoxicated operation of a motor vehicle, are social control actions. They influence substance use behavior at the individual level. The physical environment is another factor that can increase or limit a person's access to alcohol or other drugs. Because it is easier for some people to buy drugs, it increases the opportunities to get these substances, as well as makes it more normal to use them. One of my clients, an adolescent boy, shared with me that he attends a school in Detroit, in which children smoke marijuana on the school bus and inside the school. Children grow up under the influence of their families. If parents are using alcohol, children learn that this is normal. They often have access to alcohol that parents keep in the kitchen. Peer influences are also a significant risk factor during adolescent age. If parental monitoring and supervision is weak, children are more likely to interact with antisocial peers and engage in substance use. The social ecological model was first described by Uri Bronfenbrenner. This model explains the impact of multiple levels of social systems on individual development and behavior. These social systems and institutions interact and include micro, meso, exo, and macro system elements. According to this model, an individual has his or her personal biological and psychological makeup. However, as we discussed in the previous lecture, the genetic component in the substance use does not fully explain the risk of development of the substance use disorder. Family members, partners, and close friends shape the way we perceive the role of substance use in our lives. Depending on where the person is employed, they can have more or less strict policies around substance use. Also, some country policies and culture can impact substance use patterns. For example, you are statistically more likely to drink vodka if you live in Russia than if you live in Saudi Arabia, where alcohol of any kind is banned. Let's talk about social structures. The values and belief systems of different cultural groups vary a lot. Culture's values and belief systems influence the policy. Hallucinogenic substances like peyote are defined as drugs of abuse in U.S. majority culture. In Canada, the possession and use of peyote plants is legal. Labeling theory. Labeling theory is a sociological principle explaining individuals' deviant behaviors as resulting from having a deviant label applied to them. According to this theory, people are influenced by the labels that are applied to them. For example, a person is more likely to continue drinking if they are labeled as an alcoholic. The impact of isms. Experiences of oppression, discrimination, and exploitation based on racial, ethnic, social class, gender identity, sexual orientation, religious, disability, or national origin factors can be linked with increased substance use. These experiences can be associated with higher stress, and many people can use substances as a coping mechanism. Family as a social context. The family is often viewed in systems dynamic terms, where the family is more than a group of related individuals. It involves the interactions, relationships, and roles that exist across the family. Both individuals affect the system, and the system affects individuals. Children in the families learn the desired behaviors through reinforcements and observations. Families are embedded in the larger social contexts, such as extended family and friends, spiritual centers and organizations, healthcare, and child welfare systems. Substance use can be a source of stress and a coping mechanism used by the family members. Families can also play an important role in the development and treatment of substance abuse. Family members engage in various roles necessary, for example, to get food and provide shelter and protection for children. When a family member develops an addiction, it can impact everyone in the house. This is because considerable resources will be spent on substances or on dealing with negative consequences of substance abuse. One of the key areas that often gets affected is parenting. Parents who misuse substances are often emotionally unavailable to their children. They can be neglectful, children may lack in food and clothes. Parents can provide poor monitoring and supervision to their children. They might be less likely to attend parent-teacher meetings or help children with the homework. As a result, children in such families can develop behavioral problems, including substance abuse. Family disease model implies that substance abuse can negatively impact couple relationships and parent-child relationships. Still, family members and others in a person's social context may play a significant role in recovery process. Peer groups as social context. Just like the family, one's peer group provides a context for learning through behavioral reinforcement and punishment. Also, in peer groups, individuals learn from others through social learning, observation, and modeling. In groups, individuals learn about substances, how to use them and where to get them. Peer groups often define what is normal and what is not. Parents can steer the future of their children by providing or limiting access to certain peers. Some parents, for example those who live with substance abuse or a mental illness, may not really know about the whereabouts or acquaintances of their children. Other parents use strict control and supervision with their children. Some families send their children to private schools, where children can get the best education, socio-emotional development, and lifetime friendships with peers from other rich and successful families. Other families can barely afford renting a place in a low-income neighborhood that has low-quality schools, and very few other opportunities for children and adolescents. Peer support. Peer support model has been widely used in prevention and treatment of substance use disorders. This model is used with children, adolescents, and adults. In this model, individuals with similar lived experiences assist others who may be at risk of developing substance use disorder, trying to help them avoid this negative outcome.